This has been a really busy and exciting year here at Markham Stouffville Hospital, and this video highlights some of the things that we've worked on. When I think about what stood out for me, there are many things. We refreshed our strategy with a big focus on patient experience. We started working on our clinical services plan, and the intention was to identify those clinical areas, programs, and services that we needed to enhance and grow, and to do that in a very thoughtful and planned way. We had a big focus on improving and enhancing our transparency and our accountability. And in order to do this, one of the things that we instituted were monthly performance meetings for every department and service area across the hospital. And this gives us a really good snapshot for how every service area, program, department is doing. But at the same time, it gives us a picture of how that contributes to the overall hospital performance. And this has been important for building capacity across the organization and also creating shared learning and understanding for all of the leaders. We had many opportunities over the past year to profile not only our programs and services, but also to thank our caregivers, our staff, our physicians, our volunteers, and all those who contribute so much to our success. One terrific event was the celebration we held for Minister Philpott when she became Federal Minister of Health, and the entire organization was just bursting with excitement and pride. These are just a few of the highlights from the past year, but you'll hear about many more of these in the video. Thanks for making this a great year at Markham Stouffville Hospital.
As we continued our focus on patient experience, we looked at wayfinding as a way to really improve the experience that our patients have in the hospital. We know it's important for people to easily find where they're going. We've developed a strategy to look at both our internal and external signage and make significant improvements so it will make it easier for patients to navigate their way around the building. Something else that we implemented was our concierge model, affectionately known as our green shirts. This group of dedicated volunteers takes our patients right from doorway to destination. So after a patient registers, one of our green shirt concierge volunteers will escort that patient right to their clinic appointment or to the location they have to go to wait for their surgery. This is a great way for our volunteers to interact with our patients and also really takes the stress out of the visit for all the patients and families that come through our doors every day. This program has been so successful, we've decided to implement the concierge model as a permanent part of our community resources team and also trial it in some other clinics throughout the hospital, as we really think it'll have a huge impact on our patients and on their satisfaction. 2015-16 has been a really exciting year for maternal child services. We have been determined to be a program area of focus for the hospital and the community. And that means that we are poised to become leaders, provincially and nationally, in obstetrics, midwifery, pediatric, and neonatal medicine. We're also very excited about the expansion to our outpatient ambulatory clinic services, which now includes obstetrical care, including services for early pregnancy loss and postpartum follow-up. In January, we hosted an educational rounds here on site at Markham Stouffville Hospital. It was very well attended with over 100 people here on site and 13 centers across the province that joined us through OTN. This was an excellent opportunity for our hospital and our program to profile the best practice that we're doing here at Markham Stouffville, as well as to learn from some of the experts in the province and to share that so widely.
Three really cool things we're doing in IPAC this year are: 1, the use of Twitter and social media; 2, using NOCO spray to disinfect gray zone equipment; and 3, increasing hand hygiene rates. We've effectively used social media to increase our presence locally, nationally, and internationally, giving Markham Stouffville Hospital an international presence in the IPAC world. NOCO spray is a disinfecting technology that allows us to disinfect and clean a lot of equipment in a short period of time. The reason why we use NOCO spray within the NICU environment is because some of these germs will make these little ones really sick. People that have healthy immune systems can fight off infection, whereas these little ones can't. It's important that we keep these little ones safe by using the latest and greatest in technology. We take hand hygiene at Markham Stouffville Hospital extremely seriously. We've boasted over 95% compliance in the previous year, so keep up the good work. There's still a lot of work to be done though. We've recognized that hand hygiene is an inexpensive way to keep our families, ourselves, our patients, and our staff safe.
We wanted to take advantage of technology and partnerships in regard to our annual reappointment process. In the past, we used a paper-based system which took a tremendous amount of secretarial time and effort, as well as a significant amount of physician time in completing their annual reappointment. We partnered with the Mount Sinai Hospital and a group of hospitals known as CMARs to use their electronic solution to physician annual reappointments. The current process is very slick. It only takes about 7 minutes for the physician to complete their annual reappointment.
So innovation has been a priority for Markham Stouffville Hospital. We are using it to help improve our patient experience. For example, we're looking for innovation to help prevent falls, help reduce C-sections, and also to help discharge planning as we work through the emergency department. This past year, we've actually had the Virtual Office of Innovation. We've actually started a process to look at the gating process for innovative ideas. We've done some partnerships with many of the other organizations who also have innovation, and we're quite excited as we move forward. To make sure that we are on the right path, we've also interviewed some of our visitors and our patients to see what their thoughts are about innovation. We are quite excited as we move forward into next year, as we start into more of a real Office of Innovation with some staff in it, and we will be preparing ourselves to look at bigger innovations and a lot more partnerships as we move forward in the future.
Healthcare cannot succeed without partnerships. Partnering with the community is an important aspect of what Markham Stouffville Hospital is all about. The CMHA's Mobius bus is a great example of this partnership. Under the auspices of a generous donor, our Markham Stouffville Hospital Foundation, and our mental health program, we were able to support this extraordinary bus. A bus that travels throughout the York region, providing confidential health and psychological help to teens everywhere. How great is that?
MyCTE is a unique project that brings together both clinical and non-clinical staff from the front line to develop a new way of providing care that enhances the experience for both staff and the patients. Using co-design theory, the team comes together and starts with a current state analysis of our hospital. To date, the group has interviewed extensively many patients and many staff to understand what we do well and where we could improve to make the experience better for both our patients and our staff. The next steps in the process involve the team engaging even more staff in idea generation. The ideas will be collated and assembled, and the team will come up with a new model of care to trial on 3 Centre, 3 East, and 1 Centre. Those models will be honed over and over again until they land on the model that best suits our patients and our staff for the ultimate experience.
The Uxbridge site has had a busy year this year. We've been focusing on bringing our patients back into their own community close to home so they can receive the best care at the hospital that's close to them. As a result, we've had a really busy year. We've been running our inpatient unit beds at full capacity, and as well as our emerge department. We've also changed our food delivery model service to the patients. We've converted to a Burlage multi-gen cart system. It's like an oven on wheels, and it allows us to deliver hot, fresh meals to the patients right at their bedside. And I think it really enhances the patient experience with their meals at the hospital.
The Prevent Alcohol and Risk-Related Trauma in Youth program, better known as the PARTY program, will be moving into its 4th year. The program has been extremely successful and in such high demand that we are already booking schools into the program for the spring of 2017. The PARTY program is about providing community high school students with the knowledge, tools, and resources to be a star. That is, to stop, think, and act responsible. By hosting a session every 2 weeks during the school year, we have been fortunate enough to have empowered almost 400 students during this fiscal year to be a star and to carry the message forward to their classmates. This past October, the Markham PARTY program held its first major event, a mock accident held outside the emergency department. It required a large team to make it a huge organizational and media success. The team included a large number of MSH staff and community partners. Almost 100 students and teachers attended this event, and we are looking forward to making it an annual event.
As a researcher and a family doctor, we have always simple question in our minds. How do we improve the relationship between a physician and a patient? And how do we obtain more information about psychosocial and determinants of health from our patient? These two simple questions leads us to develop research projects called Pet Impact. And we have assembled a team of researchers, veterinarians, a family doctor, a nurse practitioner, and a medical writer to start researching this question. So this leads us to bring one of the largest research grants at Markham Stouffville Hospital, granted by us by Morris Animal Foundation in the United States. The question was very simple. If we teach our patients and our physicians and healthcare providers about the benefits and risks of a pet, perhaps that simple question will open the patient to provide more information to their doctors and healthcare providers. The first step of this research has been done. We're ready for a publication, and that is recruited 220 physicians, nurse practitioners, physician assistants, nurses, pharmacists, and social workers to answer these simple questions, and a lot of amazing results that we got out of this part of the research. Now we're in the second part of the research, recruited about 450 patients to take this information and take it to their healthcare providers and educate their healthcare professionals about the benefits and risk of a pet, and that also opens up to improve the patient relationship. So we're in the process of data analysis for this part of our research project.
The COPD exercise program is a 12-week program and consists of 1 hour of exercise 2 days per week. We have seen some incredible improvements in our patients' ability to exercise. Some have doubled or even tripled the distance that they have been able to walk. The Cornell Community Center has now created a graduate class, which allows these patients to continue to exercise and continue their well-being. They have recently received an Innovation Award for this program. We are very happy to be in collaboration with the Cornell Community Center.
We know that there are 1,600 people in Ontario waiting for a life-saving transplant. Out of that number, 40 of them are within our own community. And to date, we've had 51 people that have received life-saving transplants here in the Markham Stouffville Uxbridge area. So this year alone at Markham Stouffville and Uxbridge campus, we've had 3 multi-tissue donors, which really means that we have enhanced the lives of over 200 people with donation of their eyes, bone, skin, and heart valves, which is extraordinary. We've also had donors as well. We've had 2 heart donations, 2 double lung donations, 3 kidney donations, pancreas, and a couple of livers, which have saved all of those individuals' lives.
I'd like to thank all of you for what you do, because without that excellent patient experience, then the donors and the people that we ask to give back to the hospital would not contribute. So you are a critical part of the success at Markham Stouffville Hospital Foundation. For that, we are truly grateful. We couldn't, of course, do it without the staff and physicians and nurses and volunteers who also give back when they're asked, not just of their time, not just of their talent doing their job, but when the foundation comes to you to ask you for support, you also give, which is why I can't think of a more appropriate spot for me to be right now with our beautiful Donor Recognition Center in the background.
So we have a very busy emergency department at Markham Stouffville Hospital. Our volumes are constantly growing. We grow about 5 to 10% per year. And as you can imagine, if you were coming into the ED, one of the most important things, one of the most challenging things for patients and their families is understanding how long they might wait to see a provider. One of the things we instituted this year is a wait time clock or a wait time display. This is something that's displayed in our waiting room as you walk in, and also something that you can access online through the hospital website. This gives a real-time, updated, estimated length of time to physician, and it's exceedingly helpful. So as you walk in the door, as you're deciding to come to the ED, you can have a look and have an understanding that there's a reasonable chance that you'll be seen within a certain amount of time based on this wait time clock.
I lead the case costing initiative here at Markham Stouffville Hospital. We call ourselves the Show Me the Money team. We help our physicians, our clinical leads, and our support services to better understand the cost of caring for each of our patients. With that information, we help deliver more sustainable care and high quality care for our community. Thank you.
Greening and sustainability continues to be a big priority at Markham Stouffville Hospital, and it is supported by administration and supported by the staff. We were very excited the past year to have received LEED Silver designation for our new building. We received that because of one of our green roof areas which reflect heat rather than absorbing it. We have done a number of things in the past year that we are very, very proud of. We have a Bike to Work event, our annual Greening Expo with over 25 vendors participating and showcasing their green products and services, as well as the ultrasound department. We have put in designated recycling stations throughout the department, and we've eliminated the garbage waste bins. All of this is done by the great work of our Greening Committee, which is made up of staff from across the organization.
CGTA is a regional data sharing initiative which connects patient data from external hospitals and other health service providers within the Greater Toronto Area. The CGTA system provides a much broader array of information available so that our physicians and our other care providers can look at the patient's records in a more comprehensive format to support their medical decision making. This year in oncology, we implemented a new electronic module for our oncology clinic. What this enables us to do is work with our clinical staff, our physicians, and our patients so that we can better streamline their visits and their treatments. Oncology is a very complex process, and looking at the number of appointments and the scheduling that needs to be done, looking at that information in a more comprehensive way greatly supports the patient journey. One of the features that we have available in the oncology module is a patient calendar. That actually enables our patients to look at the appointments that they have coming up and better balance that with their life and their other commitments that they need to keep.
Hi, I'm proud of everything we've accomplished this past year. One is the addition of 3 new professions into our professional practice team: a respiratory therapist, a physiotherapist, and a registered dietitian. Secondly, we merged 2 advisory committees. One was our nursing advisory, the other one was our interprofessional advisory, who met separately. Now they're meeting together so they can improve and enhance our collaborative practice and improve patient care. And lastly, we introduced a monthly practice report that goes out to the entire organization, including the board of directors, which highlights all the different activities that we've been involved with in the past month.
We hope you enjoyed seeing some of the great things that we've done at Markham Stouffville Hospital over the past year. And we're already looking forward to the next year, to all of the projects and initiatives that will benefit our patients and their experiences.